Good afternoon, happy Thanksgiving everyone, and welcome to today's update on COVID-19 in New Brunswick. Speaking on behalf of the province today are the province's Chief Medical Officer of Health, Dr. Jennifer Russell, and the Honourable Dominic Cardy, Minister of Education and Early Childhood Development. Bonjour tout le monde, joyeuses actions de grâce et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-paroles aujourd'hui sont le médecin hygiéniste en chef, le Dr. Jennifer Russell, et le ministre de l'Éducation et du Développement de la Petite Enfance, l'Honorable Dominic Cardy. Dr. Russell.
Thank you, Bruce. Merci, Bruce. And thank you for everybody who's here on our Thanksgiving Monday. Good afternoon, bonjour à tous. I hope everyone has had a good Thanksgiving weekend in the safety and support of your family and friends. But I also want to offer my special support for those people who changed their plans at the last minute for their holiday to slow the spread of COVID-19. And I know for an actual fact that this did occur because a friend of mine was trying to get a turkey yesterday and she was told that the place where she was getting it from had 8 cancellations. And so at least 8 people changed their plans that I'm aware of, but I know there are many, many more. So thank you for your conscientiousness. And I also want to thank you for taking time out of your holiday to watch today's briefing. I want everybody to have the straight facts about what's happening in our province so that we can all stay safe and stay healthy. Je sais que nous profitons pas de congé de l'action de grâce de même comme nous l'aurions souhaité, mais la COVID-19 ne prend pas des congés. Nous devons absolument être prudents et faire preuve de vigilance pour éviter qu'elle se propage davantage dans la province. Aujourd'hui, j'annonce qu'il y a 6 nouveaux cas confirmés de COVID-19 au Nouveau-Brunswick. Ils sont liés aux éclosions de la zone 1, où il y a 39 cas actifs, et la zone 5, où il y a 32 cas actifs. Il y a 3 nouveaux cas dans la zone 1, une personne âgée entre 50 et 59 ans, une personne âgée entre 60 et 79 ans, et une personne âgée entre 80 et 89 ans. Il y a aussi 3 nouveaux cas dans la zone 5, une personne de moins de 19 ans, une personne âgée entre 20 et 29 ans, une personne âgée entre 60 et 69 ans. 5 personnes sont actuellement hospitalisées, dont une aux soins intensifs. Il y a eu à ce jour 278 cas de COVID-19 au Nouveau-Brunswick, dont 76 sont actuellement actifs. So this is not really the Thanksgiving that we were all hoping for or that we wanted, but as I said, COVID-19 doesn't take holidays. So we really do have to take care and be vigilant to slow its spread in our province. And while there are 6 new cases of confirmed COVID-19 in the province, we are doing everything we can to make sure all the contacts are traced and that they are isolating at home. So I'm just going to go through the same list that I just read in French of all the new cases. So the new cases are related to both of the outbreaks, one in Zone 1 and one in Zone 5. So right now in Zone 1, there are 39 active cases, and in Zone 1, there are 39 active cases, and in Zone 5, there are 32 active cases. So today, there are 3 new cases in Zone 1, one individual aged 50 to 59, one aged 70 to 79, and one aged 80 to 89. And there are also 3 new cases in Zone 5, an individual under the age of 19, an individual aged 20 to 29, and one aged 60 to 69. There are 5 individuals in the hospital, one of whom currently requires intensive care. So far, we have reported 278 cases of COVID-19 in New Brunswick, of which 76 are currently active. We are in the midst of a global pandemic, and our circumstance can and will change very rapidly, along with the information, research, and evidence-based information that we receive every day and every week from whether it's the World Health Organization or Public Health Agency of Canada. Barely a week ago, there were 3 active cases in this province, and now we have outbreaks in 2 health zones, which include potential incidents of community spread. And the way to prevent that community spread, obviously, is for everybody to do their part. I'm a parent, I have teenagers, and sometimes you're asking them to do something or expecting them to do something, and If they choose not to or give an argument as to why, then you say, well, it's the right thing to do. Yes, but, well, it's the right thing to do. So sometimes the right thing to do isn't always the easiest thing to do, but that doesn't change the fact that it is the right thing to do. So we really can't give the virus any chance. It will establish itself and spread widely, exponentially, and that's why we have acted with resolve and determination to slow the spread. The mandatory order has been amended to require the use of masks in all public indoor spaces in every region of New Brunswick. Dans les zones 1 et 5, où il y a actuellement des éclosions, le port du masque est obligatoire dans les espaces publics à l'intérieur et extérieur, comme le prévoient des modalités de la phase orange du plan de rétablissement du Nouveau-Brunswick. Je sais que vous êtes nombreux à vous demander comment aider nos concitoyens qui doivent composer avec des restrictions accrues en raison de la pandémie. D'abord et avant tout, faites preuve de bienveillance. Lorsque vous retournez au travail demain, s'il vous plaît, rappelez-vous que le port de masque est obligatoire dans tous les endroits où vous pouvez être en contact avec d'autres personnes, comme les salles d'entrée, le corridor et les salles de réunion. Ayez toujours un masque avec vous et aidez gentiment vos collègues à s'habituer à cette nouvelle réalité. In Zone 1 and Zone 5, where outbreaks are now underway, masks are required in all indoor and outdoor public spaces as set out in the orange phase of the New Brunswick Recovery Plan. And I know that many of you are asking, what can we do for our fellow New Brunswickers who are now living with more restrictions due to COVID-19? First, last, and always, we can always be kind. And when you return to work tomorrow, please keep in mind that the mask order applies to all areas of your workplace where you may interact with others, including lobbies, corridors, and meeting rooms. Keep a mask with you at all times and gently help your coworkers adjust to this new reality. Families will now be returning from the orange zones to other parts of the province. Please be kind to them as well. They're returning to their workplaces, to their schools, and public health has given clear instructions on returning safely. What they require most from you is your support and empathy. If you have traveled to an orange zone over the long weekend, you and everyone you are traveling with must continue to observe the orange phase requirements for a period of 14 days. You must wear a mask at all times, indoors and outdoors, no matter where you are in the province. And I'd like to remind everyone about how we define indoor and outdoor spaces for areas under the yellow phase of recovery. These include areas in the public where employees interact, such as retail businesses, malls, service centers, places of worship, restaurants and bars, except while eating, etc. Organized indoor gatherings in public spaces, such as weddings and funerals, common areas like lobbies, elevators and hallways, and public shared spaces, including those in private sector and government workspaces, public transportation. In Zones 1 and 5, now in the orange phase, there are further restrictions which prohibit the operations of barbers, hairstylists, tattoo artists, and other businesses that require close personal contact with clients. This information is on our website. As you know, we have revised what the different phases allow and don't allow compared to the very beginning of the pandemic in March when we had our first iteration of the phases. And I know that this can be an area of concern and confusion for many people, including business owners. And so I do invite you to look at that information very closely. And I do want you to know that, again, when public health makes a public health recommendation, it is based on a risk assessment based on that individual area's risk. And we don't take that lightly. So I have had some heartbreaking emails from business owners, et cetera. So I do understand that this is very, very tough. And that is why I'm asking everybody in this province, every citizen, to do the right thing, to wear a mask, to physically distance, because that is what's going to keep us in the yellow phase, and that way we will be having the least amount of impact in terms of people's daily lives, whether it's schools or businesses, et cetera. So the order for the orange phase areas also mandates the closing of swimming pools, gyms, fitness centers, casinos, and business bingo halls, and prohibits all sporting events. D'autres restrictions s'appliquent aux zones 1 et 5, qui sont maintenant en phase orange. Les entreprises de services personnels nécessitant des contacts étroits, comme les salons de barbier, de coiffure et de tatouage, doivent cesser leurs activités. L'arrêté obligatoire prévoit aussi que les piscines, les gymnases, les centres de conditionnement physique, les casinos et les salles de bingo situées en zone orange doivent fermer leurs portes et que toute activité sportive organisée y est interdite. Indoor gatherings of more than 10 people are now prohibited in the orange phase zones, and outdoor gatherings of 10 or fewer people may take place with physical distancing. These restrictions are necessary due to the higher risk of spreading COVID-19 in these settings. Barbers and hairstylists have sustained close contact with their customers. In gyms, the sharing of equipment and elevated activity drive up the risk. Bars and restaurants in the orange phase areas may remain open, but tables must be set at least 2 meters apart, and staff are limited to short contact with patrons. Those who live in zones 1 and 5 should limit their contacts to their 2-household bubble, maintain 2 meters of physical distance from others, and follow all public health directives such as regular hand washing. Outdoor public spaces are anywhere the public may congregate other than the yard of a private single-dwelling residence. This includes parks, playgrounds, markets, dog parks, etc., anywhere you may be sharing space with many others. When you're walking and jogging alone with members from your bubble in areas that are not crowded, such as trails or beaches, masks are not required. Les espaces publics extérieurs désignent tout endroit autre que la cour d'une résidence unifamiliale privée où se rassemblent les gens. Par exemple, les parcs, les terrains de jeu, les marchés, les festivals et les parcs canins. Tout endroit où l'on peut se trouver avec plusieurs autres personnes. It is important that everyone in all regions of New Brunswick actively self-monitor for symptoms of COVID-19, and there is a list on the coronavirus webpage at GNB, and seek testing when symptoms emerge, either by calling 811 or using the online self-assessment tool, which has been working extraordinarily well. In a number of recent cases, individuals showed no symptoms or very mild signs such as a runny nose, so please monitor your health and request a test using the online form. Students who are traveling from an orange zone or who have been exempted from isolation requirements under shared custody arrangements are required to wear a mask at all times, indoors and outdoors, for the next 14 days. The next 14 days will be critical in terms of how we see things unfolding here, and that's why the next 14 days are really, really important for people to be extremely vigilant. So all post-secondary institutions, public schools, private schools, and early childhood learning institutions, and it is the responsibility of the parents, guardian, or student to inform the teacher upon their return to school on Tuesday. There have been several confirmed cases in northern New Brunswick schools over the last several days, and Minister Cardy is going to speak to some of that information. We have had meetings pretty much all morning long with the emergency operations team, with Department of Education, around the different risks up in the north around schools. And when we say a case in a school, we don't necessarily mean a case in the school. We could be referring to a case affiliated with the school, meaning the person either works or goes to that school, but the exposure or where the transmission occurred was not actually in the school community, but it could have been outside the school community. But we are providing all of that information around the risks at each school, depending on whether it's an adult or a student or an employee, and whether it's a transmission that occurred in the school or outside of the school setting. So all of those risk assessments have been done on an individual basis based on all the contact tracing that public health has been doing. So that information has been communicated with each and every school, and the specific staff and students who are implicated have been contacted directly by public health, whether they're diagnosed with COVID-19 or whether they're a close contact. So all of that work has been done, and I'm so proud of the teams working on the ground right now to make sure that all of that work has been happening all through this entire long weekend. So thank you to all the staff, the entire team on the ground that has been doing that work tirelessly all weekend, including the EOC staff. Please keep in mind that a requirement for your child's schoolmates to self-isolate does not necessarily indicate an outbreak at their school. Again, they could be a close contact of a confirmed case from another setting outside the school. So that's why we really, as parents, we need to be very cognizant of the fact that you're either being told to self-isolate because you're a close contact, or you or your child have been diagnosed with COVID-19 because you were tested and we're calling you with the result. So I want to remind those who regularly travel from Quebec into the Campbellton area for work that they are eligible for twice-weekly testing for COVID-19, even if they are not exhibiting symptoms. Now, I know I've heard many comments about symptomatic testing versus asymptomatic testing and mass testing, etc. We're really focused on the cases and the close contacts right now and people who are symptomatic, but there are situations where we will continue to test asymptomatic people, such as the one I just mentioned, because the risk is so high outside of our borders in the Quebec area. So we are very cognizant of the fact that we rely on the workers to come into our province, and so to mitigate that risk, those are the steps that we're taking. To request a test, complete the online COVID-19 test request New Brunswick NB form and select traveler from outside the Atlantic bubble in the "Are you a member of one of the following groups" section. In the coming days, we will likely see more confirmed cases of COVID-19, and if everything goes well, those cases will be the people that we've already identified as close contacts, and they're already self-isolating at home, and therefore they can't transmit to any other people. So fingers crossed, we have a lot of work ahead of us, and we still all have to work together to be vigilant. And as each case pops up, we will continue to do contact tracing. We will continue to contact those close contacts and make sure that they're able to self-isolate properly with as much support as we can provide. So many of you may be asked to self-isolate to reduce the spread of the infection, and this is not easy. I know that's not easy, but given the incubation period of the virus, that will take 2 weeks. So we are going to really be focused on that. C'est encore plus crucial que chacun respecte les consignes de la santé publique et fasse sa part pour endiguer la vague de COVID-19. Ça va diminuer le nombre de personnes qui sont impliquées, ça va diminuer le durant des éclosions, ça va diminuer la durée qu'on va être en la phase orange dans la zone 1 et la zone 5. Mais il faut qu'on tous travaille ensemble pour avoir ce but réalisé. Nous n'atteindrions pas le risque zéro, pas avant d'avoir un vaccin ou un traitement efficace. But by acting now with kindness and patience, empathy and tolerance, we can lower the risk and go about our lives safely. We can reduce the numbers of people that are involved in both of these outbreaks. We can decrease the amount of time that we have to have those zones stay in orange, but we all have to work together. On this Thanksgiving Day, I am so very thankful for all the sacrifices that everyone is making so that we can all stay safe and healthy. Thank you for doing the right thing, and I am counting on you to continue to do the right thing. Thank you very much. Mr. Cardy.
Thanks, Dr. Russell. And happy Thanksgiving to everyone. Joyeux Action de Grâce. Not the Thanksgiving we would have hoped for, but still a lot to be thankful for on this long weekend. And as the doctor said, special thanks to those who lost their weekend to work incredibly hard across the province to pursue the contact tracing exercise that's now underway to try and make sure that we can push COVID-19 back out from our borders. And that same spirit of hard work from the folks inside the civil service and public health that's gotten us to this privileged point where we continue to be doing very well in comparison to most of the rest of the world. I know that those people wouldn't do this job regardless of the day or the time, but the fact that they're making the sacrifice on a holiday makes it extra notable. Thanks as well to the citizens of the province. I was at a cannabis MD outlet in my constituency and talking with one of the staff there, and he was saying how he'd been planning for a long time. Hadn't seen his family in quite a while, was planning on getting home, go to Campbellton and see his family. But when he heard the message come from the doctor that travel was not a good idea, he canceled, and I said, I apologize, I said, wish we didn't have to do this. And he goes, no. You guys are doing what you can to keep everyone safe. It's the least I can do is give up a family dinner. The other day, I talked about changes that affected the Listigouche First Nation in Quebec, and I just wanted to briefly mention them again. Thank Chief Darcy Gray and the council at Listigouche for their incredible cooperation throughout this process, that all the difficulties we've had in being able to support education for that school population of young students who live in that First Nations community in Quebec, but who travel to school in New Brunswick and have for years as part of a great relationship between that community and our province's school system. The fact that's had to be interrupted, the responsibility there lies at the feet of the government of Quebec, who were unable to work with us on security protocols. And the First Nation Council have been absolutely exceptional in their cooperation from top to bottom, beginning to end. So I wanted to make sure I made that point today. Alors, merci encore pour tout le monde d'être ici. C'est une joyeuse action de grâce malgré les circonstances assez difficiles qui nous présentent. C'est temps encore pour une autre mise à jour sur les changements qui impactent le système scolaire en addition des changements provinciaux qui étaient précisés par Dr. Russell. So to start off today, I'm going to say that we have had members of the Janeville Elementary School, some members of that school community have been notified of a possible exposure to an individual who tested positive for COVID-19, and that EECD will be following up with the rest of that school community in the hours to come. So potential contact tracing, as I mentioned, is being carried out and was going to inform all of our future decisions, as it has informed all of our decisions to date. And at this point in time, the decision is for Janeville Elementary School to remain open for tomorrow. And we're working closely with school districts and schools to ensure they're prepared for whenever we inevitably have a case in a school. And we'll be very quick to make changes on decisions if those are required based on the evidence that we hear from public health and from Dr. Russell's team. Sont tellement heureux et fiers de tout le travail qui a été fait dans une manière assez rapide par toute l'équipe dans les districts et dans les écoles pendant cette longue fin de semaine. Toute notre planification entre mars, avril et maintenant, c'est toujours désigné pour assurer qu'on peut agir rapidement en face des circonstances qui changent rapidement en face d'une éclosion. On avait toujours l'espoir qu'on ne va pas arriver à la situation que on voit aujourd'hui, mais nous sommes ici maintenant et on a besoin d'agir. Et je suis confiant dans l'équipe qui a travaillé tellement fort pour les derniers 6 mois maintenant pour nous préparer pour aujourd'hui. Je veux dire qu'on va avoir une réponse opérationnelle, une journée de réponse opérationnelle pour demain, mardi le 13 octobre, pour les LE Rainsborough et Académie Notre-Dame, ces 2 écoles. C'est-à-dire que on Tuesday, October 13, we're going to have an operational response day for LE Rainsborough and Académie Notre-Dame. So that means that for students, that they will not be attending school tomorrow, and they should wait to hear from your school community for further instructions. So staff are going to use this day to roll out their response plans. Students will learn from home. And this is exactly what we'd always intended, because as I've been making clear, I hope from the beginning of this pandemic, it wasn't a question of if or when we would have outbreaks like this, but how we would handle them. And so far, our handling has been world class. But now is when that response planning moves out from the behind-the-scenes work done by civil servants, people in public health, and it becomes something that involves all of you as citizens of the province. We need your help, as Dr. Russell has put it. We need your help to make sure that the work of your contact tracers can be done. We need your help to support the back-to-school plans that have been out there and made public for a long, long time. Our goal is to keep schools safe and open under as many circumstances as possible. So as previously indicated, for students at Sugarloaf High School, they're going to be engaged in online learning on Tuesday, October 13th and on Wednesday, October 14th. And that's only for Sugarloaf High School. And that's in part to make sure that we can accommodate the students from Listegouche, who I just mentioned. The school is going to be in touch with families to communicate any potential changes to the school schedule for Thursday or Friday. So we know the situation in zones 1 and 5 is changing rapidly, and that's causing a degree of anxiety that I completely understand. And I'm going to again emphasize the importance for 2 things, kindness and accuracy. That kindness is obvious, that we've been privileged here in New Brunswick to have had some of our closest contacts with the disease for a long time being fear and a bit of anxiety when we see an out-of-province license plate. But now the disease is here in our province and active. Teams are working to make sure it's controlled and that we don't see widespread community spread, transmission. But we're likely to know people who are going to get COVID-19, and they're likely to recover at the same rates they do elsewhere in the world. But we're likely to see cases of illness. And of course, all of our hearts go out to the folks who are in hospital, and especially the individual in intensive care. But when those folks come out of hospital, we've got to be kind to them. We've got to be kind to people who've needed COVID tests, because the more that we make this into a big deal where we stigmatize people, the less likely people are to get the tests, to self-isolate, to do the right thing, to protect all of us. So we shouldn't just be kind for the benefits of those around us. It's self-interested too. It's to the benefits of ourselves and our families that we do the right thing at this difficult moment. And the other point, around accuracy of information. I'm continuing to hear far too many people online and offline spreading information that they know is not true, or if they don't, they should. We are doing our best in government to provide accurate, up-to-date information with these briefings, with the dashboard, which has been slower to be updated in recent months because it wasn't as needed, but that's going back up to the hourly updates that had always been expected in the spring. And we will go back to making sure that you've got every single piece of information you can gather. I was talking with Dr. Russell before this briefing about the steps her team is making to provide ever more accurate and detailed information so that you can be part of this response, because that's the only way this is going to work. But I'd ask for folks who are online, think twice, think 3 times before you tweet, reshare, post something that you're not sure about. Do not spread information about people you think might be sick. Do not spread information about stories you might have heard from a friend of a friend about a school or a long-term care home. The way that we can get through this is by making sure the information we share is accurate so that we can make the best decisions based on that information. Je vais dire qu'on a 2 problèmes aujourd'hui. On a un problème d'utiliser l'information qui est clairement à 100% la vérité. On a besoin d'éviter dans tous les cas possibles de partager l'information qui n'est pas vérifiée, l'information qui vient des rumeurs et pas des sources officielles. Parce qu'ici, dans le gouvernement, nous sommes tous les Néo-Brunswickois et Néo-Brunswickoises. On veut que cette pandémie termine aussi rapidement que tout le monde. Et on va partager toute l'information qu'on peut pour vous aider dans votre tâche, parce que c'est votre tâche et notre tâche, une tâche collective de battre contre ce virus. La seule manière qu'on peut le faire est si on a une base d'information qui est basée sur la vérité. Alors, s'il vous plaît, pense 1, 2, 3 fois avant que tu postes quelque chose sur l'Internet lié à l'éclosion. S'il vous plaît, l'autre côté, agis avec un niveau de gentillesse, avec la bonne humeur et un esprit un cœur ouvert envers les gens qui vont être affectés par ce virus dans les semaines qui arrivent. Parce qu'on était chanceux pour quelques mois que dans beaucoup de cas, les individuels qui étaient infectés par l'éclosion par le COVID-19 étaient hors de nos frontières. Mais maintenant, avec l'éclosion qui développe dans la province, c'est fortement probable qu'on va connaître les gens qui étaient infectés. Partage pas l'information personnelle. Partage pas l'information basée sur les rumeurs. Et continue dans le même esprit qu'on a vu dans cette province depuis le commencement de la pandémie, qui nous a mis dans une position assez enviable en contexte mondial. So we're going to be having regular updates to all school staff, to families. Those are going to go through the schools and through the districts. And of course, we are going to continue to make sure we protect the privacy of all the individuals involved. So in many cases, we need to be really careful about sharing information about whether someone's a student or a staff member. Because think about yourself or your family members in that position, you want that information to be protected. We need to make sure that we have absolutely clear information going out to people, and we'll do our very best, and we assure you that there will be absolutely no risk to you as a result of any of the information that we're protecting because of privacy concerns. Because our first concern is public health, and Dr. Russell has broad powers to share all information. So please continue to listen to Dr. Russell and her teams. So, the schools we talked about specifically today, these schools are all in the orange zone. So parents are reminded to ensure students have enough masks to meet the enhanced mask use policies for orange zones. So if your school is not in the orange zone, things are continuing as they were when they were in the yellow zone. So to reiterate the message from a couple of days ago, masks are going to be required on the bus, indoors and outdoors, throughout the day, except when eating or engaged in physical activity. For students in K to 8, they'll be able to remove their masks if they're working silently alone at their desks. And these policies are going to apply to all students, to all teachers and staff, unless they are not required to wear a mask for medical reasons, and this is going to apply throughout the duration of the orange phase. All intramural, interscholastic, and extracurricular sports and activities will be suspended in these zones until they return to yellow. Pour répéter ça, avec ces changements, on va voir les politiques d'utilisation des masques dans des écoles en orange, en la phase orange qui sont amplifiés, changés depuis la semaine dernière. Et tous les détails sur ça sont disponibles sur le site web du ministère de l'Éducation. Je vais aussi prendre ce moment pour vous souvenir que même s'il y a un élève ou un membre de l'équipe scolaire qui a demandé de auto-isoler à la maison, ça ne veut pas dire qu'il y a un cas confirmé. S'il y a un cas confirmé de COVID-19 dans une communauté scolaire, cette information va être partagée premièrement avec toutes les familles et la communauté scolaire et aussi avec le grand public, juste comme Dr. Russell a fait depuis le commencement de la pandémie. An individual may be identified as a close contact to a case for a number of reasons. So just because they've been asked to self-isolate does not mean that they will test positive. So as I said on Saturday, please remember that no news is good news. So the Orange Phase document with all the details for K-12 schools and early childhood education is available on the Department of Education and Early Childhood Development's COVID-19 updates website. And all these measures, again, only apply during the Orange Phase to the schools within the Orange Phase areas. As soon as we go back to yellow, those schools go back to yellow, and unless there's a specific reason for any exceptions, the activities that were allowed and that were normal, that we became used to in the yellow phase, become daily life again. So reiterating Dr. Russell's message that please take every precaution that you can. I've had people asking me, I was planning on going to visit this school for X reason. I was planning on taking a trip here and there. If you don't have to go anywhere, stay home. If you can reschedule, cancel. Push events back to a later date. The next 2 weeks are going to be critical in fighting back against these two outbreaks in zones 1 and 5. So please do everything you can. Accept the small inconveniences in life in the next couple of weeks to avoid not just inconveniences, but potential tragedies for families across this province. So for all the schools that are still in the yellow phase, you continue on with your regular operational plans. So that includes masking, the restrictions on sports and extracurricular activities, all the things that you become familiar with over the last few weeks, those are still in place for all schools in the yellow zones. So parents and guardians should ensure that your children have got more masks than maybe you've given them before, multiple masks, so they can wear them throughout the day for the next couple of weeks. You do not want to be without your mask. Tout le monde a besoin de souvenir que les parents ont besoin d'assurer qu'ils ont assez de masques pour utiliser pour chaque journée. Pendant les prochaines quelques semaines, c'est encore plus important que d'habitude. Aussi, que tous les élèves il ne va pas être permis de participer dans les événements sportifs ou les autres activités extracurriculaires pendant les prochaines 2 semaines. En prenant les précautions assez simples, tu peux contribuer à la sécurité, pas seulement de la communauté scolaire, mais à votre communauté et votre province en grand. So we've had New Brunswickers again, we've come together and worked together in a way that I think the whole province has been proud and even surprised at in the last 6 months, at the way we've managed to reach up above so many other places in the world. So please, again, be vigilant. Please follow the directives from public health from Dr. Russell's team and make absolutely sure that you take every step possible in your day-to-day life to protect yourself and your community and your family against this deadly disease. And before I go, I want to clarify one thing, that earlier on talking about the updates for the dashboard, those updates are every day, not every hour, before I give the folks who are responsible for that a heart attack. Of course, as usual, be happy to take questions here from the journalists. One question, one follow-up, as usual, and happy to take that from now. And again, hope everyone has a good remainder of their weekend. Stay safe. We're all doing the best we can to keep everyone safe.
Before we start, could everybody please mute? Shane McGee, CBC. Oh, excuse me, I have to say something. Nous allons maintenant procéder aux questions des journalistes. Vous avez toujours le droit de poser vos questions dans la langue de votre choix. Chaque journaliste aura une question et un suivi. We will now proceed with questions from members of the media. Each reporter will have one question and a quick follow-up. You have the right to pose your question in the language of your choice. Shane McGee, CBC.
Hi, this is a question for Dr. Russell. The rules around outdoor masks, can you elaborate on why this was implemented, and given that we've heard that there's lower risks of transmission outdoors?
Is that Shane? Hi, Shane. So basically, when a phase orange is in place in a zone, we're really trying to contain things very, very aggressively. So if you're going to shut down businesses, if there's any way that you can make sure that there is very, very, very little risk in terms of continuing to be able to contain the virus, then we will be trying to take those steps. So having people mask indoors and outdoors, then that means that it's continuous. Everybody's protecting each other, and we do know that even though people can be mingling outdoors, they don't necessarily always physically distance. And again, we are just in the containment phase when there's an outbreak, where we just want to be as aggressive as we can to get things under control as soon as possible with the fewest number of people affected for the shortest length of time.
Thank you, Dr. Shane. Do you have a follow-up?
Yeah, given the number of new cases that we've seen over the last week, how is the province able to keep up with the amount of contact tracing that's required to be done?
Well, thankfully, yes, we have, but it hasn't been easy or simple. So we've basically mobilized all the 4 regional teams across the province to be able to make sure that we stay ahead of the timelines that we need to do the contact tracing and make sure people are isolating. The other piece of that work is not just contact tracing, but also making the connections between the different contacts to make sure that they are in fact all related, as opposed to community transmission. So all the work that has needed to be done over the course of the last week has been done. Quite an extraordinary effort, but we have managed to meet all our targets, and we're confident that the people who needed to be contact traced are at home self-isolating right now. And so the next 2 weeks are going to be critical because of the incubation period, to watch to make sure that the people that are self-isolating at home, if they develop symptoms and become COVID positive, that they are not at risk of infecting others because they are self-isolating at this moment in time.
Thank you, Doctor. Thank you, Mr. McGee. Vicky Hogarth, Charlotte County TV.
Thanks, Bruce. My question is for Minister Cardy. Minister Cardy, experts say it's not so much class size that matters in terms of COVID-19 spread in schools, but rather classroom density and airspace. How are school ventilation systems being continuously monitored to ensure they are adequate, especially as the winter months come into play?
Hey, thanks for the question. Absolutely, air quality is important, and we have regular assessments for air quality in our schools, and it is something that has been on our radar right from the very beginning of the pandemic, is making sure that air quality and those standards are kept to the highest level. We've still got work to do, but certainly in the context of COVID-19, we've made sure that our classrooms are safe for those reasons. At the same time, class size also is very important. These things all go together and are all part of a package of responses to try and protect our students and our professional staff who work in the schools. Encore juste brièvement en français, les questions de circulation d'air dans les écoles, c'est absolument quelque chose qui est important, lié à les autres initiatives pour réduire la transmission de COVID-19, incluant la réduction dans le nombre d'élèves dans les salles de classe. Et on prend tout ça comme sérieux. Alors, c'est tous les différents éléments d'une réponse compréhensive et intégrée pour combattre le virus.
Thank you. Thank you, Minister. Ms. Hogarth, did you have a follow-up?
I do, thanks, Bruce. I'm just wondering what criteria would trigger a long-term closure of a school.
So at this point, we've not made any changes to those criteria, which are all identified in detail on the ECD website with a lot of different variables on there. And obviously, if there's anything exceptional that came up in the face of a pandemic that is new to the world and presenting us with new challenges, so we follow the template that's been worked on in consultation with public health over the last number of months. And if anything urgent came up, take direction from public health on how to respond to it. Alors pour les cas de fermer, quand est-ce qu'on va fermer les écoles? Ça va être en utilisant les métriques qui sont déjà inclus dans le plan sur le site web du ministère, qui précise exactement dans quelles conditions est-ce qu'on va considérer la fermeture d'une école. Et aussi, s'il y a quelque chose d'urgent, quelque chose nouveau qui arrive, qui est toujours possible dans une pandémie, avec un virus qui est aussi nouveau, on va prendre l'avis du Dr. Russell et son équipe aux santé publique. But the goal is to keep our schools open and safe. Ça, c'est le but, que les écoles restent ouvertes et sécuritaires. Et oui, c'est difficile. Et oui, ça va créer des fois des inquiétudes avec les parents et les familles, les enseignants. Je comprends ça complètement. Mais on ne peut pas perdre une autre année de l'école. Pour les raisons de santé mentale, raisons d'éducation. On a besoin de reconnaître la position centrale du système d'éducation dans la vie de notre société et d'enlever 10-15% de la formation totale d'un élève. C'est quelque chose qui va avoir les conséquences pour les générations. Mais ça ne veut pas dire qu'on ne va pas avoir les mesures sécuritaires pour assurer que nos écoles sont aussi sécuritaires que possible. So we recognize that this is a frightening moment. We talk about trying to keep schools open as much as possible, but that's always been the goal because we can't afford to lose more than 10% of a child's education, losing a year or more of schooling. So our goal is to keep the schools open and to keep our schools safe, and to do that in the context of a virus that's always changing and a response to it that is always being updated based on the latest scientific information, thanks to Dr. Russell and her team and the folks at the Department of Health.
Thank you, Minister. Thank you, Ms. Hogarth. Travis Fortnum, Global TV.
Hi there. My question is for Dr. Russell. I'm just wondering if you're able to confirm the 5 cases that are in hospital, are those linked to the outbreak at Manoir Notre Dame?
So 4 of them are linked to the outbreak in Zone 1, and I believe one of them is linked to the outbreak in Zone 5.
Second question, Mr. Fortnum.
That's all I had.
Thank you. Laura Lyle, CTV.
Thank you, Bruce. This question would be for Dr. Russell. Given that cases in other provinces in Atlantic Canada remain relatively low compared to New Brunswick currently, I'm wondering if there are conversations underway from other public health officials involved in any other kind of temporarily closing New Brunswick borders off to the rest of the region.
I've been having conversations with the chief medical officers of health from the other Atlantic provinces quite regularly and keeping them up to date on the situation here. So my understanding is that from Nova Scotia's perspective, they've never really had any closures in terms of not allowing people in, but they've always had a 14-day self-isolation period for people outside the Atlantic bubble. As of right now, they are not planning to make any changes based on the outbreak here in New Brunswick, the 2 outbreaks rather here in New Brunswick. And with respect to Newfoundland, I think, well, actually all 3 of the other provinces are advising the people that are coming back from Zone 1 and Zone 5 to their respective provinces that they should behave the same way that we are directing people to here within New Brunswick, that they should continuously mask and monitor for symptoms for the next 14 days.
Thank you. Laura, do you have a follow-up today?
Yeah, just a quick one. I'm just wondering about any additional testing sites or testing resources that have been brought into the sites of the 2 outbreaks, so Campbellton and Moncton, where people can go to get tested, that kind of thing.
So right now in Zone 1 and Zone 5, and then previously in the St. Stephen area, we had really boosted our ability to test in those areas. And so the 811 phone number is one way, but we also have a self-referral form online. And my understanding is that they're keeping up quite well with the testing demand at this point in time. So the extra resources are definitely on hand, and certainly even the 811 resources were also on standby in case there was a surge in their demands as well. So as of right now, we can meet those demands in a very timely manner. So people who have symptoms can get tested. Just call 811 or go online and fill out the online assessment form.
Thank you. Ms. Lyle? We're good?
All good. Thanks very much.
David Caron, l'Acadie Nouvelle.
Oui, je me demandais si ce serait possible juste d'élaborer un peu sur la situation à l'école de Janeville, dans la région Chaleur.
Thanks for the question. So first important note is that Janeville is in a region that is not in the orange phase. It is in the yellow. And so we are reacting there right now to, again, a possibility of a contact, and the contact tracing is being undertaken, and everyone in the school community will be notified about that. As I mentioned earlier, Public Health has already notified some families. M'excuse de répondre en anglais en avant. Quelque chose d'important de préciser, que l'école à Janesville, c'est dans une région qui est encore dans la phase jaune, pas orange. Et jusqu'à ce point, on n'a pas d'intention de changer ça. Alors, c'est une cas d'une possibilité d'un contact qui implique quelqu'un à Janesville. Et la santé publique est en contact avec quelques familles les dernières heures, et le ministère de l'Éducation et du Développement de la petite enfance va être en contact avec le reste de la communauté scolaire dans les heures qui arrivent, et c'est ça pour ce moment. Mais pendant un temps d'une éclosion comme ceci, c'est fortement probable qu'on va avoir des incidences comme ça. Ça va être quelque chose qu'aujourd'hui, c'est les gens dans zone 5 et zone 1 qui ont besoin d'être plus habitués, d'être en contact avec les officiels de santé publique et le reste des ministères de santé pour le traçage des contacts. Mais c'est quelque chose qui est fortement probable qui va arriver dans les autres coins de la province. So we've got to get ready to get used to this. That having possibilities of cases, people being asked to self-isolate while waiting for test results. This isn't a reality the rest of the world has unfortunately had to become very used to in the last number of months. And the fact that we're having to get a bit more used to it, again, hopefully only for a short time, this is just a normal part of how we respond to the pandemic, and this is how it'll work. So everyone, again, put on your masks, stay home, please, for the next 14 days as much as you possibly can.
Merci, Monsieur le ministre. Monsieur Caron, as-tu suivi cet après-midi?
Oui, j'ai une autre question pour quelqu'un. Je me demande, peut-être que ça a déjà été répondu dans le passé, mais j'ai manqué ce bout-là. Mais est-ce que, pour le mandat obligatoire de porter un masque en public, à quel point est-ce qu'on va renforcer cette mesure? Est-ce qu'il va y avoir des amendes ou quoi que ce soit pour quelqu'un qui ne porte pas, ou est-ce qu'on s'attend qu'il y ait une certaine dissension par rapport à ça, des gens qui refusent tout court d'emporter se rentrer à l'ordre?
Allô, alors je sais, il y a beaucoup de questions sur le sujet de porter des masques dehors. C'est seulement dans les zones qui sont en phase orange. C'est vraiment pour nous aider à diminuer l'impact de l'éclosion, de diminuer le nombre de personnes qui sont impactées et diminuer la durée de l'éclosion pour qu'on peut arriver à retourner en jaune dans ces zones-là et les entreprises pourraient réouvrir. C'est vraiment important qu'on travaille ensemble. Alors, pour porter le masque en hors, c'est des endroits où les gens se rassemblent vraiment. Ça veut dire les rues, les trottoirs, les sentiers. Puis, si vous êtes vraiment toute seule, il y a personne qui est là, vous marchez, vous courez, faites la vélo ensemble ou avec votre bulle dans votre maison, ben ça veut dire que si vous n'êtes pas proche d'autres gens, ça veut dire que vous n'avez pas vraiment besoin de porter le masque dans cette situation-là, mais plutôt dans les régions oranges, c'est vraiment important de sans doute, si vous avez des doutes, portez-le. Ça, c'est la chose la plus sécuritaire. Puis, j'aimerais qu'on suit toutes les directives de santé publique. Et je sais qu'il y a des gens qui ne sont pas d'accord avec les directives, mais c'est vraiment pour la sécurité de toute la province, toutes les entreprises, notre santé mentale et pour garder les écoles ouvertes. C'est très important qu'on travaille ensemble pour cette but.
Merci, docteur. Merci, Monsieur Caron. Andrew Watt, Brunswick News.
Yeah, hi. I have a question for Dr. Russell. Dr. Russell, can you give us a little bit of an update on the outbreak at the Manoir Notre Dame, please? I'd like to know how many cases are now confirmed linked to that, and whether you've found the source of the outbreak.
So the good news is the contacts have been traced. All of the cases and contacts in Zone 1 are all related to the manoir. So again, thank you to all the contact tracers who have been doing an excellent job. Their attention to detail is phenomenal. So we have 39 cases in Zone 1 right now, all linked to that outbreak, including the manoir.
Okay.
Do you have a follow-up, Mr. Waugh?
I do, thank you. What about the Campbellton region outbreak? Have you figured out how that started?
Well, again, the good news in Campbellton is thanks to, and Dalhousie, thanks to all of the contact tracers and everybody on our teams who have been working so hard. All of the cases have been contacted, their close contacts have been contacted. All of the cases are linked, and so we are very grateful for that because, as you know, community transmission is the thing that we dread the most, and there is no community transmission in either of those outbreaks right now. With respect to the manoir, in terms of our response, the plan was to test all the patients and all the employees at the manoir every few days, and so that next round of testing is tomorrow. And if everything goes well over the next 14 days, then the new cases that pop up are the people that we have contacted that are self-isolating and can't transmit to anyone else at this time. So again, we all need to be working together to make sure that we achieve a really good outcome with respect to keeping the numbers low and keeping this outbreak short and sweet and small. That is our hope.
Thank you, Doctor. Thank you, Mr. Waugh. Alexander Silberman, CBC.
Thank you, Bruce. A question for Dr. Russell. What discussions have you been having with the other Atlantic provinces about the bubble, and what has the tone of those discussions been like?
Well, again, with any outbreak, and we have two ongoing at the same time, it's all about updating our risks assessment regularly as we receive new information. So obviously at the very beginning of an outbreak, until we contact trace, we really don't know the extent. So we can't say, oh, this is bad, this is good, this is medium in terms of our risk level and what our concerns are. So I've just really kept in close contact with Dr. Strang, Dr. Morrison. Dr. Fitzgerald is actually on holidays. But I've kept them in the loop in terms of texts and emails and phone calls. So they are aware with the messaging that we have each day in terms of our risk assessments and how things are going. Then they are aware, okay, well, we're on standby. If we need to change any of our messaging, then we will. If we need to change anything in terms of our public health direction, then we will. And really, so far, what they've done is they've just used the same language that we have around anybody who's traveled to Zone 1 or Zone 5 over the holiday weekend. When they return to their respective areas, whether it's here in New Brunswick, PEI, Nova Scotia, Newfoundland, that they follow the same directions that we are giving our citizens around wearing your mask, when you go back to your region. Please avoid contacting other people, being in contact with people unnecessarily, especially vulnerable populations, et cetera. So we're just trying to share the same messaging based on our risk assessments as they evolve.
Thank you, Doctor. Mr. Silberman, do you have a follow-up?
Yes, I have a follow-up for Dr. Russell. So going back to the Campbellton region outbreak, do we have any more details at this point on possible source and how it ended up getting to these three schools?
So all I can tell you right now is they're all linked and there's no community transmission. I don't have any more information to share at this point other than again, we're confident that all the contacts have been traced and everybody who needs to be self-isolating is self-isolating. And in terms of moving forward, we will continue to give you the most up-to-date information that we can. And again, anybody who needed to be contacted from public health in the school communities that are implicated, they've all been contacted.
Thank you, Mr. Silberman. Thank you, Dr. Wildenet Paul, Radio-Canada.
Merci, oui, je suis là. Bonjour, merci beaucoup. Alors, ma question est pour M. Cardy. Alors, bonjour, j'aimerais savoir où on en est rendu avec les écoles qui recensent des cas de COVID-19. Combien de personnes devront s'isoler? Est-ce qu'on parle de classes, de plusieurs classes? Et peut-être vous expliquer ce qui va se passer concrètement pour ces élèves-là au retour.
C'était un peu difficile d'entendre la question. Est-ce que tu peux juste répéter un peu? C'était juste peut-être un problème avec la ligne ou mon compréhension.
Alors, je veux savoir où on en est rendu avec les écoles qui recensent des cas de COVID-19. Combien de personnes qui vont devoir s'isoler? Est-ce qu'on parle de classes ou de plusieurs classes en ce moment? Alors, quel est l'état de la situation?
So at this point, we can't share the detailed information like that again. Je m'excuse, je vais faire en anglais après. Mais c'est l'information comme ça. On va être en communication avec toutes les personnes, toutes les familles, tous les individuels qui ont besoin d'être contactés pour les raisons de sécurité. côté de santé publique. Et on ne précise pas quelle classe, quel nombre de classes, etc., juste parce que ça peut commencer de créer on peut commencer nous-mêmes les rumeurs et ça serait quelque chose de tellement négatif. So we're not sharing information about anything except for confirmed case numbers, because that's the stuff that actually matters. If there's an outbreak, you need to know about it. When we're doing testing and trying to do contact tracing, that's the work that's going on to make sure that we're all kept safe. But we need to remember that, again, that we're protecting the privacy of people as well as protecting the health of everyone.
Merci, M. le ministre. Mademoiselle Paul, as-tu suivi cet après-midi?
Oui, merci Bruce. Alors, la prochaine question est pour Dr. Russell. Il y a le député de Campbellton-Daly qui dit vous demandez d'envisager d'offrir le test à toute la communauté de la zone 5 et de fermer les écoles de la région. Est-ce que c'est quelque chose qu'on envisage, d'offrir le test à toutes les personnes des zones en phase orange pour le moment?
Alors, je comprends les inquiétudes et je comprends les questions sur la manière qu'on approche la zone 5 et la zone 1, mais c'est tout basé sur l'information et aussi l'avis du médecin hygiéniste en chef dans les régions. Alors, il prend compte de la situation, il prend toute l'information et on fait nos décisions au sujet de soit la fermeture d'une école ou le dépistage avec toute cette information. La première éclosion qu'on avait à la région de Campbellton, on avait testé, je crois c'était 25% de la population à ce temps-là, je crois que c'était 12 000 personnes. Et il y avait 0 cas, un résultat de faire des dépistages des gens qui n'avaient pas des symptômes. À ce moment-ci, on a assez de ressources pour offrir les tests pour les gens qui ont des symptômes. Il n'y a pas de problème. Et on a augmenté les mesures sur les gens qui voyagent chaque jour, les travailleurs essentiels, etc. Alors, ceux qui travaillent, qui voyagent va-et-vient juste à côté les frontières, ils peuvent être testés 2 fois par semaine. Alors, c'est vraiment quelque chose qu'on prend les décisions basées sur l'information qu'on a. Ça, c'est les informations sur les dépistages. Sur les écoles, les décisions pour fermer une école, ça serait soit basé sur des situations opérationnelles où il y aura tellement de contacts étroits qu'il faut qu'ils s'isolent, qui sont en auto-isolement dans la maison, soit des staffs, soit des professeurs, soit des étudiants, que ça sera vraiment pas fonctionnel d'avoir de rester ouvert dans une situation comme ça. Alors, des fois, c'est à cause qu'il y a plusieurs cas, il y a plusieurs risques, il y a plusieurs risques de transmission, il faut isoler plusieurs demandes. Alors, c'est vraiment des situations où ça peut être qu'il y a quelqu'un qui est un contact étroit, mais il n'y avait pas un risque de transmission à l'école, il n'y avait pas un risque de transmission à l'intérieur de l'école, mais c'était quelque chose qui est arrivé en hors de l'école, mais à cause il y a quelqu'un qui est lié à l'école, soit un étudiant, soit un staff, etc., qu'il y a des risques, mais selon les risques, c'est ça qu'on va baser nos décisions si une école doit être fermée, soit parce qu'il y a des gens qui sont à risque ou ils sont en isolement, puis ça pourrait pas être fonctionnel de rester ouvert.
Merci beaucoup.
Merci. Merci, Mademoiselle Paul. Margot Castader, Radio-Canada.
Oui, bonjour. Cette question est pour le Dr. Russell. Hier, une porte-parole du gouvernement nous confirmait que les masques à l'extérieur étaient obligatoires partout, en tout temps. On l'entend vous nuancer aujourd'hui. Pourquoi adopter une telle mesure, sachant que vous êtes la première législation au Canada à demander le port du masque à l'extérieur?
Alors, ça, c'est pas nouveau. Ce qui est nouveau, c'est à tout alentour, dans la phase jaune, dans le Brunswick, on porte des masques à des endroits à l'intérieur qui sont des espaces publics. Ça, c'était annoncé, je crois, la semaine dernière. Mais la situation où c'est obligatoire à l'intérieur et l'extérieur, ça, c'est quelque chose qui a été mis dans notre phase orange au même temps qu'on a introduit que les masques seraient obligatoires à l'intérieur dans la phase jaune. Alors, c'est juste comme, en anglais, coincidence. C'est un peu coïncidentiel que c'est tout arrivé en même temps, qu'on a des éclosions, on va dans la phase jaune, je m'excuse, dans la phase orange. Alors, c'est tout fait en même temps, mais c'est vraiment la distinction entre la phase jaune et les phases orange, c'est que dans la phase orange, c'est obligatoire à l'intérieur et à l'extérieur.
Merci, docteur. Margot, as-tu suivi cet après-midi?
Oui, parce que ça ne répond pas à ma question. Je comprends la distinction, mais sur quoi vous vous basez pour adopter une telle mesure?
Alors, je crois qu'il y a de l'information sur notre site Web sur les 3 phases et ça a changé depuis le commencement de la pandémie dans le mois de mars. Alors, au commencement de la pandémie dans le mois de mars, on avait nos phases, puis il y avait des listes de choses à l'intérieur des phases qui nous diraient c'est quoi les déclenchements qui vont nous dire on va avancer à la phase jaune, on va reculer à la phase orange ou on va reculer à la phase rouge. Un des déclencheurs, c'est si le public suit les directives de santé publique. Et on sait que à cause des résultats d'une surveille qui a été faite par le département de sécurité publique, les nombres qu'on a eus, les pourcentages des gens qui ne portaient pas les masques et suivaient les directives de santé publique étaient plus bas qu'on voulait et ça augmentait le risque. Et ça, c'est un des déclencheurs. Il y a plusieurs déclencheurs, mais ça, c'est une des déclencheurs qu'on a utilisé pour changer la phase à orange. Et alors, c'est pour ça que c'est vraiment important.
Merci beaucoup, docteur. Merci, Margot. Voilà la fin de notre mise à jour. Merci beaucoup et joyeuse action de grâce. Happy Thanksgiving, everyone, and that concludes today's update. Thank you.